hands-on navigation of EHR software. To effectively use an EHR system, healthcare providers must be proficient in several key tasks related to patient information management. Here's how to navigate and perform these tasks within EHR software. Searching for patient records. Search by patient information. You can search for a patient's record by entering identifiers such as the patient's name, date of birth, medical record number, MRN, or even by their appointment history. Advanced search filters. Many EHR systems allow for more specific searches, such as filtering by diagnoses, medications, or specific visit dates. Search results. Once the search criteria are entered, results are typically displayed in a list format, allowing you to select the correct patient from multiple matches. Documenting patient information. Clinical notes. Entering clinical notes during patient visits is crucial. Most EHR systems provide templates for different types of clinical encounters, including SOAP, subjective, objective, assessment, and plan, or narrative-style notes. Structured data. Some systems offer structured data fields where specific information, e.g., vital signs, symptoms, diagnosis codes, must be entered in predefined fields to ensure standardization. Free text fields. Other sections allow for free text input, where the healthcare provider can describe patient symptoms, history, and assessment more freely. Charting progress. Clinicians can document progress and changes in patient health, treatments, and results as the visit proceeds. Many systems allow for voice-to-text functionality, speeding up the documentation process. Updating patient information. Adding new data. If a new diagnosis, medication, or lab result is available, it must be updated in the patient's record. This ensures the patient's medical history is current and accessible. Medication orders. Adding new prescriptions or adjusting current medication orders can be done directly in the system, ensuring that pharmacy staff receive accurate and timely orders. Lab results. When lab results are received, they are usually entered electronically into the system, either manually or through automated data transfers from the lab. Follow-up and referrals. Scheduling follow-up visits and referring patients to specialists can be managed directly through the EHR by entering new appointments or generating referral letters. Sending and receiving data. Electronic orders. EHR systems often integrate with laboratories, pharmacies, and imaging departments, allowing healthcare providers to order tests, medications, or imaging studies directly through the system. Patient portals. Some EHR systems offer patient portals where patients can access their records, request prescriptions, schedule appointments, or send messages to healthcare providers. Customizing EHR settings for individual and practice-specific needs. EHR systems are often customizable to meet the unique requirements of healthcare providers or practices. Customizing settings can improve workflow efficiency, ensure compliance with practice-specific protocols, and enhance patient care. Below are some key areas where EHR customization can be applied. 1. Personalizing user interfaces. Dashboard. Layout. Users can typically customize the layout of their dashboard by choosing which panels and alerts are displayed. For example, a clinician might prioritize lab results or appointment schedules, while a nurse may focus on vital signs and medication lists. Color coding and themes. Many EHR systems offer customization of color schemes, making the system more visually comfortable and allowing clinicians to easily identify critical alerts through color coding. 2. Templates and forms. Clinical note. Templates. Providers can create or modify templates for common clinical scenarios, e.g., physical exams, chronic disease management, to standardize data entry. This can save time and ensure that important details are not missed. Procedure and medication. Templates. For specific conditions or treatments, EHR systems can store predefined procedure protocols or medication orders, which can be quickly adapted to each patient. 3. User roles and permissions. Role-based access. To ensure security and privacy, EHR systems allow administrators to set different user roles and permissions. For example, a nurse may have access to vital signs and medications, but not to sensitive patient history or diagnostic codes. Audit trails. Many EHRs also allow practices to customize settings related to audit trails, tracking who accessed or edited patient records and what changes were made. 5. Clinical Decision Support, CDS. Customization, guideline-based alerts. Customizing CDS tools to align with practice guidelines can ensure that providers are alerted when a patient's data indicates a potential problem, e.g., missing vaccinations, overdue screenings. Personalized treatment protocols. Some systems allow for tailoring treatment suggestions based on a practice's preferred approaches or clinical pathways, providing support for consistent care delivery. Integration with other tools. Third-party software. Integration. EHR systems can often be integrated with other healthcare technologies, such as diagnostic imaging tools, telemedicine platforms, and patient management software. Customizing these integrations ensures a seamless flow of information. Patient monitoring devices. Some practices may integrate EHRs with devices such as blood pressure monitors or glucose meters, allowing real-time data entry from these devices directly into the patient's EHR. Clinical documentation and best practices. Accurate and efficient documentation in electronic health records, EHRs, is essential to provide high-quality patient care, ensure legal compliance, and streamline healthcare workflows. Best practices for clinical documentation help reduce errors, enhance patient safety, and improve communication among healthcare teams. Accurate and efficient documentation in EHRs. 1. Importance of accuracy in documentation. Accurate documentation ensures that patient data is correctly recorded, which directly impacts diagnosis, treatment decisions, and patient outcomes. Mistakes or omissions in clinical notes can lead to misdiagnoses, incorrect treatments, and even legal liability. Accurate documentation supports billing, coding, and reimbursement. Incorrect or incomplete documentation can result in claim denials or audits, affecting financial outcomes for healthcare organizations. 2. Efficiency in documentation. Efficiency in EHR documentation allows healthcare providers to spend more time with patients rather than on administrative tasks. Efficient documentation leads to quicker information retrieval, better coordination of care, and reduced clinician burnout. Time-saving techniques. Using templates, voice-to-text features, auto-complete functions, and preset clinical protocols can significantly speed up the documentation process while maintaining accuracy. 3. Real-time documentation. Documenting information as it is collected, real-time, rather than relying on end-of-day charting, ensures that patient data is up to date. Real-time documentation also supports continuity of care by providing immediate access to accurate and current information. Clinical templates, standardized coding, ICD, CPT, SNOMED, and structured data entry. Clinical templates. Clinical templates are predefined structures that guide healthcare providers in documenting patient encounters consistently. They ensure that important clinical information is captured and organized in a standardized way. Benefits of clinical templates. Consistency. Templates promote standardized documentation, which reduces variability in how patient encounters are recorded. Efficiency. Predefined fields or prompts help speed up the documentation process by reducing the need for manual input. Clinical decision support. Templates often include embedded clinical decision support tools, e.g., reminders for screenings or vaccination, which improve patient care and ensure compliance with practice guidelines. Standardized Coding Systems, ICD, International Classification of Diseases. ICD codes are used to document diagnoses, conditions, and diseases. Accurate coding using ICD-10 is essential for reimbursement, epidemiological reporting, and clinical decision-making. CPT, Current Procedural Terminology. CPT codes are used to report medical procedures, services, and diagnostic tests. Correct use of CPT codes ensures that healthcare providers are appropriately reimbursed for the services they provide. SNOMED CT, Systematized Nomenclature of Medicine, clinical terms. SNOMED is a comprehensive clinical terminology system used for coding clinical concepts such as diseases, procedures, and findings. It ensures the uniformity and precision of documentation and improves interoperability between healthcare systems. Structured data entry. Structured data fields. EHR systems often use structured data fields, where healthcare providers select from predefined options, e.g., drop-down menus, checkboxes, radio buttons, rather than typing free text information. Structured data entry allows for better data analysis, reduces errors, and ensures that essential clinical information is consistently recorded. Benefits of structured data. Interoperability. Structured data is easier to share and exchange between different EHR systems and with other healthcare organizations. Clinical decision-making. Structured data improves the ability of clinical decision support tools to provide relevant recommendations and alerts. Data analysis. Structured data facilitates better analysis of patient outcomes, research, and quality improvement initiatives. Optimizing EHR for clinical workflows, speed and accuracy in documentation. Optimizing for speed. Voice-to-text technology. Using speech recognition software can significantly reduce the time spent typing. This is particularly useful in documenting clinical notes or adding detailed descriptions during patient interactions. Template utilization. Standardizing the use of templates for common clinical scenarios, e.g., physical exams, patient assessments, accelerates documentation by reducing the need for repetitive data entry. Auto-population features. Many EHR systems allow for data to be auto-populated from previous visits, such as medical history, medications, and lab results. This minimizes redundant data entry and ensures consistency. Predefined orders and smart lists. Smart lists, predefined order sets, and clinical pathways can reduce the time spent selecting appropriate treatments, tests, or prescriptions, allowing for faster clinical decision-making. Optimizing for accuracy. Error. Checking features. EHR systems often include built-in error-checking capabilities, such as alerts for potential drug interactions, medication allergies, or missing documentation, e.g., incomplete clinical notes. These features reduce the likelihood of documentation mistakes and enhance patient safety. Standardized terminology. Using standardized clinical terminology such as ICD, CPT, and SNOMED helps ensure that the information recorded is consistent, accurate, and universally understood. This also helps avoid coding errors that can lead to billing issues or miscommunication between providers. Clinical decision support. CDS tools integrated into EHRS help clinicians adhere to evidence-based guidelines, remind them of necessary screenings or preventive care, and support informed decision-making. By leveraging CDS, Providers can reduce errors and enhance the quality of care. User customization for efficiency. Personalized workflows. EHRs can be customized for individual clinicians or departments to better match their workflow preferences. For example, different providers, e.g., nurses, specialists, and physicians, may require different information or view it in distinct ways. Customizing the interface and data input methods helps clinicians focus on the most relevant information and improve their documentation efficiency. Shortcuts and hotkeys. EHR systems often offer customizable shortcuts or hotkeys that allow users to quickly access frequently used functions or documentation fields. This can significantly speed up repetitive tasks, such as adding medications, entering vitals, or documenting follow-up instructions. Mobile access. Many modern EHR systems provide mobile access, allowing clinicians to access and update patient records on the go, especially in settings like hospitals or clinics where they need to be mobile throughout the day. Training and ongoing support. Training programs. Adequate training on EHR systems ensures that healthcare providers understand how to use the software efficiently. This includes training on navigating templates, utilizing decision support tools, and entering structured data accurately. User support. Ongoing support and troubleshooting ensure that clinicians can quickly resolve any issues with the system. Support can include IT help desks, user manuals, and continuous updates or upgrades to the software. EHR integration with other healthcare systems. The integration of electronic health records, EHRs, with other healthcare systems is crucial for ensuring a seamless flow of patient information across different stages of care. By connecting EHRs with systems like laboratory, imaging, and pharmacy databases, healthcare providers can improve patient outcomes, enhance care coordination, and streamline workflows.